Now let's talk about the therapeutic index and therapeutic window. Now these are measures of drug safety. The therapeutic index is defined by the equation TD50 over ED50. Now, the TD50 is the dose of the drug that is toxic in 50% of the population. If we took everybody in the world and we gave them a certain dose of the drug, the dose that would cause 50% of the population to get sick or side effects would be the TD50. Now, the ED50 is not the erectile dysfunction 50. No, it's the effective dose 50. The drug dose that's going to be effective in 50% of the population. Now, ideally, a good drug has a high therapeutic index, meaning the drug requires only a small dose to be effective, but would require a large dose to be toxic. This means taking accidentally double dose would unlikely cause harm. So looking at this equation, would you prefer to take a drug that has a high therapeutic index or a low therapeutic index? The higher the therapeutic index, the safer the drug. You can see in these graphs, which depict a large therapeutic window, a high TI is fly, is how I remember it. Now, you want a drug with a high therapeutic index. Please note that the therapeutic index equation may be modified in animal studies, and you may see toxic dose 50 replaced by lethal dose 50, where that's the median lethal dose. Now, we've also got a topic of therapeutic window. A therapeutic window is a measure of drug effectiveness for a patient. It can be thought of as the minimum toxic dose minus the minimum effective dose. Okay, so that's the therapeutic window. It is simply a range of drug doses between the minimum effective dose to the minimum toxic dose. So safe drugs, in the end, will have a high therapeutic index and a large therapeutic window. So here's another way to illustrate this. We see in a graphic that combines therapeutic index and therapeutic window together to separate the two. Now, we see two curves here. One is the effective dose of a drug. This is the effective dose of the drug. Notice how at this point, nobody is getting a therapeutic effect from this drug. However, as we move to this point, right here, 50% of the people who are taking this drug are receiving some sort of effect. Now, we also have another curve, which is going to be the toxic dose curve. So now let's tie in the concept of the therapeutic index. Now, remember from our formula that the therapeutic index is TD50 divided by ED50. The therapeutic index is a comparison of the 50% from the toxic dose to the effective dose. The therapeutic window, on the other hand, is a measure of the minimum toxic to the minimum effective. So you see the minimum effective to the minimum toxic. And then this would be your therapeutic window. So you want a high therapeutic index and you want a high therapeutic window. Let's do a quick flash quiz. The lowest effective dose of drug X is 200 milligrams per deciliter. If given at 600 milligrams per deciliter, drug X is going to be lethal. So what is the therapeutic window of drug X? Now, you should knock this one out of the park. You don't even need a calculator for this one. The answer is going to be 400 milligrams per deciliter, which is simply the minimum effective dose of 200 to the minimum toxic dose of 600, giving you a difference of 400 milligrams per deciliter. So that's going to be your therapeutic window. Now let's take a break from pharmacology review and transition into a few practice USMLE style questions. We've got a 43-year-old man with a long history of chronic renal insufficiency. He comes to the ED for a 5-day history of productive cough and shortness of breath. Physical examination reveals rales in the middle lobe of his right lung. A chest x-ray reveals consolidation in that same area. Now, he begins therapy with levofloxacin. Which of the following indicates how the dosing of the levofloxacin would differ in this patient as compared to a patient with no underlying health problems? So remember, this patient's got chronic renal insufficiency. Now, here are your options. You've got a higher loading dose, higher maintenance dose, and I'll let you read through the rest. I'll give you a little time to think about it. So you need to treat this patient. But how are you going to do it? You don't even care what medicine he starts. He starts levofloxacin. But this is asking, what do you need, a high loading dose? Do you need a low loading dose? Or does it matter? Does it matter a normal person versus a 43-year-old with long-standing chronic renal insufficiency? Alright, think you know the answer? Now, if you chose F, you would be correct. The same loading dose and a lower maintenance dose. In patients with impaired renal or hepatic function, the loading dose should remain the same as a healthy person. This is because the formula for loading dose, which is plasma concentration times volume of distribution times your interval divided by your bioavailability. Now, here's your loading dose equation. Notice how there is no indication for clearance. You don't need clearance when talking about a loading dose. So, nowhere in this formula is there anything about clearance of the drug. You know, if somebody has impaired clearance, it will not affect the loading dose. So this is going to be important to remember on the USMLE because they love to trick you and ask questions regarding loading and maintenance doses. Sometimes they may ask you to calculate the dose. Sometimes they may ask you a conceptual question just like this. Now, the maintenance dose is equal to the concentration of the plasma times the clearance times the dosing interval divided by bioavailability. So note here that there is clearance in the equation. So someone that has chronic renal insufficiency, for example, or impaired clearance will have a maintenance dose that needs to be adjusted. So it needs to be dialed down because of the toxicity or side effect concerns. Alright, so let's just flash back the options here. So here you'll need the same loading dose because clearance is not factored into the equation, and a lower maintenance dose. Alright, we've got another one here. A 43-year-old woman presents to the emergency department following a motor vehicle accident. She sustains no serious physical injuries, but she appears drowsy and states that she is very sleepy. Now, the staff collected several open medication bottles from the floor of her automobile. Although the contents of these bottles could not be determined, the patient recently filled a bottle of diazepam that is almost empty. Now, the patient becomes quickly unresponsive and stops breathing. What is the mechanism of action of the agent that would reverse her symptoms? Would it be a competitive agonist of gamma-aminobutyric acid B receptors, competitive agonist of glycine receptors, competitive inhibitor of gamma-aminobutyric acid A receptors, or competitive inhibitor of glycine receptors? Now, give you a second to think through these. Think back, we briefly covered the concept of agonist-antagonist relationship of benzodiazepines. Now, diazepam is a benzodiazepine. Now, what is the mechanism that treats a diazepine overdose? Ready for the answer? Correct answer is C. So recall that flumazenil is going to be used to treat a benzodiazepine overdose. The benzodiazepine would be the agonist in this situation, and flumazenil would be the inhibitor. Specifically, it's going to be a competitive inhibitor, which we've already talked about. So do you remember the characteristics of a competitive inhibitor? Remember, the competitive inhibitors resemble the substrate, and they bind to the active site on the enzyme. So on a Lineweaver-Burke plot, competitive inhibitors are going to increase the Km, so the x-intercept is shifted to the right, which means they decrease the potency and the affinity. On the other hand, competitive inhibitors do not alter the Vmax, so the y-intercept is unchanged compared to the uninhibited graph. So these practice questions are, about the length of a typical USMLE question. They should take you approximately 30 to 40 seconds to read and look over the answer options, and then give you a little time to think about the answer and choose the best answer. So in this option, you can get rid of options A and B immediately, because a competitive agonist would not reverse the effects of diazepam. So only a partial agonist would diminish the effects, but not reverse the effects like the question is asking. Next, I already briefly touched upon the fact that benzodiazepines, such as diazepam, act on the GABA-A receptor. Now, I like these questions because they test a little bit of memorized material, but also force you to apply this to a conceptual question as well. I took these questions off the USMLE RX QMax question bank, which has quite a few questions that you may see again on test day. Now, my biggest recommendation is doing as many practice questions as possible and watching through these videos to make sure you understand everything about what you'll see on test day.